everybody, this is Julie.
And I'm Kara.
And we thought we might make a little short video about our practice because we have started getting a lot more inquiries with the COVID pandemic going on and people just kind of interested in home birth and what it means and what it looks like. So we thought we'd talk to you a little bit about that today.
Right. We'll post this, I guess, on our Facebook page probably and in our website also. And definitely this doesn't replace, if you have other questions, emailing is super easy. The nice thing that you can email us directly from our website, which is midwivepartners.net, and it gives you a link that emails directly to our email. Great way just to ask specific questions. Even we can email you back. We definitely can hop on the phone if we need to, but we definitely started sounding a little bit like a broken record, repeating the same thing several times a day, and unfortunately we just don't have all that time to spend when we're trying to take care of our current moms too. So we're super excited if you're watching this and are considering home birth, whether you're changing out of a current situation with your pregnancy or have a new pregnancy or planning for future pregnancies. So yeah, but we're sitting in our office. This is one of the rooms we'll do prenatal visits in. That we're in Lenexa, also have an office over in Missouri, and Julie will go over to Home Holistic some, which is in Old Overland Park. So we do see our moms and families in our office setting until we get closer to the end of pregnancy, and pretty much follow a similar pattern as you would with an obstetrician or other midwives. See you monthly starting out, and every 2 weeks at 28 weeks, and about weekly the last month. And that's, can be a little bit flexible there too.
Sure.
As far as getting you in, it really depends a lot on your history and your pregnancy and your comfort level as when to come in for that first visit. Some come as early as 6 to 7 weeks, especially first time moms have maybe more questions and want to really get things going early. Some come at 10 to 12 weeks. We didn't hear that heartbeat that first time. So,
right. And our visits are a little bit different in the sense of they're much longer. Usually our first visit with you, getting to know you and your history and everything, is at least an hour, and sometimes it actually is up to 2 hours. And usually our regular prenatal appointments are at least 30 minutes. So we schedule to where we don't have you waiting in our waiting area for very long typically. So that's kind of nice, but yeah.
Kids are welcome. We have a play area in their kind of front waiting area, we call it, although you're really not in a waiting room much. But sometimes we use that for visits if the kids are having a lot of fun with the toys they're playing with. Our front exam room, where we are able to do gynecology visits, pap smears, annual exams, has a tent and a play area too. So that is definitely
very family friendly. We are.
Yeah, kids get involved with the prenatal visits. There's a little stool they can stand up next to mom and help measure mom's tummy and find the baby's heartbeat and all that. So that's lots of fun too.
Yeah.
As far as seeing us, some people see us kind of evenly 50-50 between Julie and I. Some people fall into one of our schedules more, but we really try to have you meet with both of us at least a few times for your visits, because we do both do our best to attend your birth.
So yeah, so when it's time for you to have your baby, we're both gonna be there with you.
Right, correct.
So, and we'll be there typically when you are in active labor is when we try to get to your home. I guess before we talk about that, we do make a 36-week home visit, so we know where your home is and what it looks like and where you might want to put your birth pool if you're planning on using our birth tub that we loan out to you. So yeah, about 36 weeks is when we do that. And then yes, we come to your home when you're in active labor and we help you through that. Although doulas are always welcome, of course, at any of your visits or at your labor. After you deliver your baby, we will come back in a day or two to check on both of you. And again, we'll check on you at a week and 6 weeks. And so a lot of our parents don't choose to take their babies to any sort of primary care provider or pediatrician yet, because we're doing all of that at those follow-up visits. We're weighing the baby and making sure that everything seems nice and healthy. So that is part of your care as well.
Right. And we do alter that a little bit. As far as postpartum care, we're always readily available through text and phone. Sometimes we have first-time moms, and not always first-time moms, but people maybe struggle a little more with breastfeeding, so we're able to come over more often if we need to for weight checks and really follow up closely on that. We have lactation that we can refer to for help also. But really it's definitely customized to what every family needs postpartum.
Or even during your pregnancy
during
and delivery,
pregnancy,
it's
too.
all very personalized care
Right.
and individualized care. And
Exactly. I mean, those are kind of the big questions we tend to get. Trying to think of anything else that we'd want to touch on. We can definitely go over fees. We're right in line and competitive with all the other midwives that do home birth in the Kansas City area. Previously, we've been a network with insurance. Those things are always fluxing and changing. So some of those will be specific to even where you live and what plans you have and that too. And debating not taking insurance completely, that is just kind of, like I said, kind of evolving.
Yes,
so
always
those would be
evolving.
more specific questions directly through email or phone. So yeah.
Some people have when you were saying it just reminded me of an email I got recently and had some questions in it. And one of the questions was, again, like delayed cord clamping, for example. We definitely do delayed cord clamping. Basically, our cords, are left attached for about an hour after delivery. So once a baby is born, whether it be born in the birth pool or in your bed or wherever, we let you hold your baby. You can help pull your baby up to your chest and hold your baby and just recover for the next hour, basically, while we kind of tidy up and just make sure that you and your baby are transitioning well. But yeah, it's nice to have that family time. Sometimes we'll give you a little time after delivery with just you and your family and be very quiet and unobtrusive. So then we weigh the baby, we give the baby an assessment before we leave the house. We get the mom up to the bathroom and make sure everything is good with her. So that's kind of how the postpartum at home works. Let's see, other questions. Again, yes, we help with breastfeeding. We can't necessarily diagnose tongue ties and things like that, but definitely if you're having problems that we can't assist you with, we have lactation consultants to pass on to you.
Yeah, and for people who've had hospital births, very common questions are how to get my birth certificate and social security numbers. So we file all of that information either online or by paper, depending on if you're in Missouri or Kansas. You'll get a social security card number sent to you if you choose, and then can order your birth certificate. We do the things the hospital does for birth, which is the newborn state screening, heel stick. When we come back to see you the next day or second day after birth, we'll do the hearing screening either at your house or in our office with our machine. So yeah, all those things that you would be getting in the hospital, we take care of. So it's very easy and easy to do. So
yeah.
Those are pretty much the most common things. Think of anything else?
I don't think so.
Oh,
yeah, it's just, a lot of it is just personality. I know getting to know people and, trusting people, and that's part of home birth. That's a big, huge part of home birth. So definitely spending time with you and learning about your wants and your needs is what home birth is about, and honoring client autonomy, family autonomy, and what they prefer, be it injections, vaccinations. We do listen to your baby in labor, and we carry Pitocin, and we have things like that for emergencies, but we talk about everything together as providers for you. So.
Right, and then like other home birth midwives, we offer the standard lab testing that's done in pregnancy, offer ultrasounds if desired and when needed, can refer out to high-risk perinatologists or even other OB doctors as needed too. So all those things, I think sometimes people aren't sure if you're choosing home birth, does that mean you get less care and you really get the care that's necessary for your pregnancy. But once again, talking about why all those things are done and why all those lab tests are done and recommended, and some might not fit everyone. So those are things that we discuss with you and have lots of information on also.
So yeah, I think that's probably about it. And
a good overview.
Yeah, a little overview there.
Yeah.
And if you have further questions or want more information, feel free again to email us or call us, and we'll get back to you as soon as we can.
And definitely look at our social media accounts. Got to plug that
That's
a little
true.
bit. So Facebook, if you just search Midwife Partners, you'll come up with our practice. And then we're on Instagram, Midwife Partners Homebirth. If you become a part of our practice, we have a closed group called Midwife Partners Group, where we will share just things that we know that not everyone necessarily cares as much about, or things that are more just pertaining directly to our group of clients. So that is about it. So hopefully we'll hear from you, and good luck deciding where you want to be. And it's great you're watching this, because that means you're informed and thinking about all of your options and what is best for you. And really, home birth, because of some late transfers, we've had to really help people evaluate home birth and where you give birth, whether it's home, hospital, or birth center, is where you feel the safest and the most comfortable for you and your baby and your family. So we hope to chat with you soon about further things. So thanks for listening.
Bye.